Welcome, everyone. The webinar will begin at the top of the hour and will be recorded. Connect with the campaign for grade level reading on social media. On Facebook, like the page Campaign for GLR, and on Twitter, follow the account at Reading by Third. Please use hashtag Learning Tuesdays and tag us to tweet anything you learn from today's webinar, and we'll be sure to retweet. We encourage you to share your questions, reflections, and observations on social media. Once again, we would love to connect with you. So on Facebook, like the page Campaign for GLR, and on Twitter, follow the account at Reading by Third. The webinar will begin shortly and it will be recorded and shared with you afterwards. Okay, once again, welcome to today's webinar. My name is Sierra Sanchez, and I will be behind the scenes helping to produce this webinar. I have just a few housekeeping details before we get started. First, we would love for you to introduce yourself, so please use the chat box at the bottom of the screen to share your name, city or state, and your organization. Be sure to select panelists and attendees so that we all know who is here. All attendees are in listen-only mode, but we encourage your engagement by posting questions in the Q&A box. We will dedicate the last 20 to 30 minutes to respond to the questions you post during the discussion. This webinar is being recorded, and a link to the recording will be emailed to all who registered. We will be posting a brief on-screen evaluation during Q&A and highly encourage you to respond. This helps us with our commitment to continuous improvement. Lastly, before we start, I would just like to call your attention to our two final GLR Learning Tuesdays webinars this year. December 15th at 12:30 p.m., we have a funder to funder conversation. This session will focus on advancing policy solutions to reduce child poverty, presented by the William T. Grant Foundation. December 15th, that same day at 3 p.m., we have Scaling Playful Learning, How Civic Infrastructure Can Support Our Youngest Learners. And our 2021 lineup begins on January 12th. A conversation with Randy Weingarten of AFT and Becky Pringle of NEA on lessons from 2020 and how we move the education agenda forward. We will be sure to add links to those sessions in the chat box and registration for those upcoming learning opportunities. Joining you now is Yoli Flores, Chief Learning Officer for the Campaign for Grade Level Reading. Thank you and enjoy the webinar.
Thank you, Sierra, and welcome to each and every one of you joining us today for this GLR Learning Tuesdays webinar, Lessons from Tulsa Seed, Supporting Learning and Wellbeing During COVID. As we continue our Learning Loss Recovery webinar series, today we're learning from a study led by researchers at Georgetown University and the University of Oklahoma. The study, launched in 2016, has been looking at the effects of attending pre-K programs on children's learning and development. This year, the study took a close look at the impact of COVID on children's learning. Clearly, we would anticipate an impact just simply knowing that children would not have the benefit of a full year of pre-K. But there were also other critical findings that we might not have anticipated or thought about or looked at carefully. It's these findings and insights and the response of education leaders at the local level that we hope will inform our network of communities, local funders, and our partners across the country so that we can best determine where to focus our time, our attention, and our resources as we all work to slow, stop, and reverse learning loss. And with that, I am honored and delighted to introduce to you our moderator, Dr. Ioma Iruka, who's been a panelist in the past, so welcome back. Dr. Ioma Iruka is a research professor in the Department of Public Policy and founding director of the Equity Research Action Coalition at the Frank Porter Graham Child Development Institute at the University of North Carolina in Chapel Hill. Yoma is focused on strengthening anti-racist, anti-bias, and equitable research practices and policies to ensure the excellence and well-being for young, diverse learners, especially Black children, families, and communities. So Dr. Iruka, welcome back. I hand this over to you and look forward to a great conversation.
Well, hello, everybody, and thank you so much, Jolie, for welcoming me back. I'm so pleased to be here, and so pleased to be here with the presenter we're going to have, as well as the commentators. I'm happy to introduce the presenter, Dr. Anna Johnson. Anna Johnson is an associate professor in the Department of Psychology at Georgetown University and co-director of the Child Development and Social Policy Lab. Anna's research sits at the intersection of developmental science and public policy, focusing on evaluation of public programs that promote healthy development for vulnerable children. In this vein, Anna is currently leading a 7-year longitudinal study of low-income children who attended publicly funded preschool in Tulsa, Oklahoma, called the Tulsa Seed Study. Well, welcome, Anna. And then I'm going to introduce our 3 commentators. First, I'll introduce Dr. Cindy Decker, who is the Executive Director of Tulsa Educare, an agency operating 4 early childhood centers in under-resourced communities that are part of the Educare Learning Network. Formerly, she worked at CAP Tulsa, another Head Start agency in Tulsa, as the Director of Research and Innovation, and served on the Board of Education for Tulsa Public Schools. She holds a PhD in economics from the University of California at Berkeley and enjoys spending time with her 2 teenagers and husband. Welcome, Cindy. And Dr. Deborah Gist. She is the superintendent of Tulsa Public Schools and has been an educator for more than 30 years. Deborah has served as classroom teacher, literacy program director, and policy analyst for the U.S. Department of Education. She was the first state superintendent of education for Washington, D.C., and served as commissioner of education for the state of Rhode Island, where student achievement reached historical highs and graduation rates increased significantly. She holds a Bachelor of Science in Early Childhood Education from the University of Oklahoma, a Master of Arts in Elementary Education and Curriculum from the University of South Florida, a master's degree in public administration from Harvard University John F. Kennedy School of Government, and a doctorate degree in education leadership from the University of Pennsylvania. Such a pleasure to have you, Superintendent Gist. And finally, but not least, we have Emma Kane. Emma is the Community Engagement Director at United Way of Wapolo County in Ottumwa. I should have practiced this before Iowa. She is the co-lead for the Ottumwa campaign from grade level reading. The Ottumwa campaign's focus is to convene community partners and holistically approach grade level reading with interventions from birth to 3rd grade for families as a whole, emphasizing taking responsibility, to address past harm perpetrated by individuals and systems of white supremacy against minoritized populations. They're working diligently to ensure their work is diverse, equitable, and inclusive. So with that, I welcome both presenter and commentators. So we'll start with Dr. Johnson. So welcome, Dr. Johnson. We're so eager to hear about your project, and really tell us how COVID-19 is impacting students' learning and what you have learned so far with your amazing long-term project. So with that, I'll turn it over to you.
Great, thank you so much, Yoma. Yoma and I have known each other for a long time, so I'm pleased to come back together in this forum and just delighted to be here. Thank you, Yoli, and the campaign for inviting me, and of course, Dr. Gist, Dr. Decker, Emma. I'm thrilled to be here with everybody. So I'm going to go ahead and share my screen, and you guys will let me know if you can see it.
We can see it. Thank you.
Thank you. So as Yoma said, I'm going to talk a little bit about lessons we're learning from an ongoing 7-year longitudinal study in Tulsa, Oklahoma called the Tulsa Seed Study. I'm going to just zoom out for 1 second and just say a little bit about what we know. I'm a developmental psychologist by training. What do we know about the effects of poverty, the stress that poverty causes, and the impacts of those 2 things separately and together on child well-being? During normal times, there's decades and decades of documented research highlighting how growing up in poverty is a known risk factor for less than ideal child development. So we know that growing up in poverty increases the risk of two key factors that have been linked extensively to reduced child well-being and less optimal child learning. And those factors are household food insecurity and parental depression. So food insecurity is inadequate access to the food of the quantity and quality needed to support a healthy lifestyle. And of course, parental depression, and in our case, maternal depression, because most of the respondents in our study were mothers, maternal depression or depressive symptoms. These are both disruptions in the family ecosystem that we know, like I said before, are linked with decreased child educational, behavioral, and health outcomes for children. It's not surprising why this might be, caregivers who are hungry or worried about providing food, who are experiencing symptoms of depression. They might be distracted, short-tempered, irritable, impatient, and withdrawn. So that's just a little bit of background to say that, decades of research in developmental science and public policy suggest that poverty, which increases the risk of food insecurity and depression, is associated with negative child well-being and learning outcomes. And that's during normal times. And then it's kind of like we interrupt our regularly scheduled research programming with this pandemic that, as everybody knows, has contributed among households with young children in particular to increased rates of these very bad things that we already know harm child development. So the COVID-19 pandemic has increased rates of food insecurity and parental depression, especially among low-income families. And this has been documented nationally and also in our Tulsa Seed study. So what is Tulsa Seed? Yoli mentioned a little bit about it. SEED stands for the School Experiences and Early Development Study. And Tulsa Seed has been following low-income families and children in Tulsa, Oklahoma since 2016. So we started when our cohort or sample of children were 3 years old, and we're going to follow them through 4th grade, which will be 2023. It's about 1,000 children in the sample, and we do a lot of things with them every year. So we started when they were in preschool. Some of them were in the very educare centers that Dr. Decker oversees. Some of them were in Head Start centers. Some of them were in school-based pre-K classrooms when they turned 4 years old. So starting back then in 2016, we followed these children using multiple methods of data collection. We directly assess them, paper and pencil tests of their cognitive skills, teacher reports of their behavior skills. We observed them in their classrooms and observed their teachers. And then we sent surveys out to their parents, their teachers, and in some cases, the school administrators. And we've done this every year since 2016. When COVID-19 happened, our study children were in 1st grade last year. So schools closed in March of 2020, and our study children were 2/3 of the way through their 1st grade year. So instead of continuing with our regularly scheduled programming, we pivoted quickly and embedded a pair of COVID surveys into our SEED study from May to July. So we asked parents who we've been following this whole time and children's 1st grade teachers about their experiences with the very things that we know are harmful to child development. So we asked about food insecurity. We asked about mental health, about depressive symptoms and other stressors like household chaos. And we asked about parents' experiences helping their children with remote schooling. And what we learned from those surveys is that families have faced high rates of loss of work, going along with that loss of income and food insecurity. So about 46% of the parents who responded to our survey reported that they had lost their jobs or seen a decrease in their work hours. Nearly 50% of our sample reported experiencing food insecurity. So again, that's worrying about food, not having enough food of the right kind, quality to fuel a healthy life for themselves or their children. And nearly 60% reported a decrease in household income. So really big economic effects of COVID-19 on the low income parents and children in our sample. And like I said in the beginning, we already know that poverty is causing a lot of stress in these families. This is just going to amp that up. So not surprisingly, depressive symptoms in our sample, which also increased, and I'll show you that in a minute, were tied to increased rates of food insecurity. So parents who were experiencing increased food insecurity were twice as likely to report feeling depressed as parents who didn't experience food insecurity as a result of COVID-19. So parents and children's mental and behavioral health seem to be suffering during this crisis. 1 in 4 parents in our sample experienced depressive symptoms since the start of the pandemic. And nearly 50% of the parents said their child, which is the study child we've been following since 2016, reported increased emotional or behavioral problems since the beginning of the COVID-19 crisis. So really big impacts on parents' well-being, parents' mental health, and then children's mental and behavioral well-being. So we also interviewed teachers. Like I said, we've been interviewing teachers every year since 2016. In first grade, we interviewed teachers about their experiences with these same threats. Many of these teachers had children of their own at home, their parents too. They were trying to manage their own child's remote learning while they were doing their best work to teach the children in their class. So a lot of teachers reported the same negative things that parents experienced. So 20%, 1 in 5, reported food insecurity, and 1 in 4 reported a decrease in household income. Now, the teachers kept their jobs because they continued to teach, but they may have had someone in their household who used to be a wage earner lose their job or decrease their work hours or wages. So there was an impact on the household income, even of our stably employed teachers. 1 in 3 teachers experienced depressive symptoms. So that's also a really stark statistic, suggesting that teachers struggling under the burden of this crisis were feeling those effects in their own mental health. Similarly with parents, food insecurity and depression were correlated. So about half the teachers who were food insecure reported feeling depressed compared to 1/3 who were not. So those 2 things seem to go together. And we don't really know, based on this research or other research, whether one causes the other. It could be that individuals who struggle with depressive symptoms have a hard time planning meals. It could also be that not having enough food to feed your household makes you feel depressed. We don't know chicken egg there, but those 2 things go together. We know they're both very damaging for children. So lest you think that Tulsa is unusual in having these negative effects of COVID-19, there's national data. This is just a snapshot from a report from the Brookings Institution showing very similar patterns. So this is not just Tulsa, this is everywhere. What this figure is showing is the actual rate of food insecurity among households with young children after COVID being much higher than what it was predicted to be if you were just looking at patterns in a kind of more typical year. So 1/3 food insecure, which tracks somewhere between our teacher and parent rates of food insecurity. So really high rates of food insecurity nationally, no different in Tulsa. So all of this together might explain why education and policy scholars have been sounding the alarm about COVID exacerbating income-based achievement gaps. So we know, like I said before, poverty is associated with less than optimal child learning and well-being outcomes. COVID is just going to make it worse. So parents who are worried about food access and who are depressed are more likely to struggle with the added burden of supporting their children's remote learning. Learning from home is a big burden on parents, particularly for the young children in our sample. So 1st and 2nd graders are not going to have an easy time logging on by themselves. They most likely, share a device with another household member. They're going to need a lot of parental support. And so that's an added burden to parents who are already struggling with increased food insecurity, job loss, income loss, and depressive symptoms. So in our Tulsa Seed sample, 65% of low-income parents reported in our survey struggling with distance learning. The top reason they struggled was that the child needed more support than the parent had time to provide. So a lot of trouble with parents being able to set aside that time to help their young child navigate remote learning digitally. Parents also reported a lack of or inconsistent internet access. This is a national problem, not just in Tulsa, and a hard time finding a quiet place for the child to work. In our sample, 20% of children never communicated with their teacher during distance learning. So that's a parent report that once schools moved to remote learning in the spring, the teacher never made contact, the child never made contact with the teacher. This is lower than national rates. So nationally, about 38% of children in low-income households never logged in after schools went to remote learning. So Tulsa is doing better than national estimates, but that's still very concerning. Zooming out to some national data here, this is not Tulsa data, but just to give you a sense, we're still at the very beginning of understanding what the impact is going to be on children's learning. So we're still in the fall semester, approaching the winter holidays. We don't really know the full scale of learning loss that might have happened post-COVID. What we do know is from national data, again, in this case, using logins to an educational math app called Zern that is linked with the Common Core math curriculum and used by many public school districts in the US. What you see is the kind of pre-COVID logins and earning of badges in this math app. So it's a math app where kids log in, they do grade level math activities, and they earn a badge every time they complete a module. And you can see here that the dark blue line, which is high income, children in high income households, the green line, which is children in middle income households, and the kind of teal line, children in low income households, are all tracking similarly before COVID. They're all logging in, doing their Zern, earning badges at roughly the same rate. And then COVID hits right around March 16th, which is when Tulsa Public Schools closed. And again, this is national, this isn't Tulsa, but this tracks Tulsa data. And what you see is the children in low-income households drop off Zern login and badge earning much more dramatically than children in high-income households. So these are not test score data. These are not high stakes data. This is just a math app. But it certainly suggests that low-income children are going to experience a much bigger loss post-COVID school closures in their connection with school-related educational activities than are children in higher income households, perhaps because of things like internet access, having a quiet place to learn, and parents not having enough time to help their children, exactly what we saw in our data. And very recently, this was just released at the end of November, so 2 weeks ago, from the NWEA Collaborative on Learning. Again, national estimates of growth in math skills in third graders from 2019, what you would have expected kids to come back in the fall of 2019 with math skills growing from the prior year. That's the salmon colored bar, much higher growth last year than this year. So the green bar is how much growth, in this case, third grade children experienced in math from the year before. And this is that COVID learning slide that people are so worried about. So this is national data. This is not perfect, but it certainly suggests that there's less growth in math scores from the winter of 2020 to the fall of 2020. That's the green bar. Than there was from the winter of 2019 to the fall of 2019. That's the salmon colored bar. And unfortunately, this is probably an underestimate of the impact of COVID on student learning because the most disadvantaged students were most likely to be missing these kinds of national data. So the learning loss that we haven't fully estimated yet, at least in Tulsa Seed, we predict to be quite large. We expect it to be larger in math than in literacy, which would track with national data. And that's because math takes, at this age, our kids are now in second grade, more concerted teaching and effort on the behalf of a teacher, in theory, than does reading, although you could certainly make the case that early literacy skills need contact with teachers as much. So what can be done? Schools and school districts are lifelines for families during this crisis. So our partners in this research are the Tulsa Public Schools. They have gone to heroic efforts to buoy these families. When we spoke with our contacts in the district in the spring, the first thing they said was, our priority is connection, connection, connection. Keep these families connected to schools. And that is probably why the rate of kids logging in Tulsa is higher than nationally. They have done heroic work. And not just in terms of keeping students connected to teachers, but in providing things for families like food support and technology support. So we asked our families in our SEED COVID survey, what was the most important support you received from the school district when school was closed? And 53% of our families said meals. So schools in Tulsa, at least, and in many other places across the country, became spots for grab and go meals, almost like food pantries, and really were a lifeline to these food insecure families. The second biggest area of support that families in Tulsa in our study reported was technology support. So Tulsa Public Schools deployed Chromebooks so that families could maintain learning at home, and in some cases, mobile hotspots to facilitate internet access. So again, schools and school districts are lifelines, and we have to keep that up in the absence of other social programs that are going to fill that gap. So for those looking, for what else can be done, there's still an internet access problem. It disproportionately affects low-income and marginalized communities. So increasing internet access through mobile hotspots. Some cities like Tulsa and others have gotten really creative, equipping unused school buses and city buses with mobile routers, deploying them to neighborhoods that need them the most. So thinking really creatively about increasing internet access. We saw these effects of depression on low-income families in our sample. So increasing the availability of mental health resources. A lot of school districts, including Tulsa, are using Canvas, they're using Zoom. There's an opportunity to build check-ins with a school counselor, a school nurse, a school social worker into a remote platform. So just having a little link, maybe it's a thermometer, maybe it's a friendly looking face with a hand reaching out, and the kid can click on that link for office hours with a mental health counselor for the family or the child. And then finally advocating, as we all do, I think, in our work lives, for expanded access for supports for these families. Most importantly, probably unemployment and other cash benefits. We know from other research that unemployment explains a lot of the COVID-induced increase in food insecurity. So increasing cash in the hands of these families would be a critical need that we could all advocate for. So I will wrap up there. And I really want to thank our partners at TPS, Dr. Gist and her extensive, incredible team. And of course, the families and teachers in Tulsa who responded to our surveys and who continue to be part of our Tulsa Seed community. So please email me with questions, and I will look forward to hopefully answering some of them today.
Well, thank you, Anna, for such a thorough response to sort of the question of what has been the impact of COVID-19. And before you hop off of camera, Anna, I just want to ask you a question that came in, and we have just a little bit of time, is sort of thinking about sort of what we're seeing with the national data, and then with you having this much more laser focus on Tulsa, what do you think about the learning loss, right? The question came from Mike Talley, who said, do you have any predictions about how kids will fare, at least the Tulsa public school kids will fare due to the pandemic? I mean, obviously you're not a oracle, but can you tell us, especially with the supports being provided?
Yeah, I mean, I think I see no reason to suspect that Tulsa kids are going to be, magically protected from the learning loss that we're seeing. Just again, it's just the very beginning. It's just barely December, and anyone who knows anything about research knows it moves more slowly than we would all like it to. So, we're not really going to have a great handle on test scores and assessments until we can get back in and do those, and we can't do any in-person assessment right now. But there's no reason to suspect that Tulsa kids will be magically protected from those losses. So the losses seem to be bigger with in math in those national data sets than reading. Our kids are in second grade. That's a key year. You're still learning to read, not yet reading to learn. So it's possible that we'll see equally big effects on literacy. We just don't know yet. But I'm concerned, as I would be for children in any part of the country, that there's going to be marked loss around kind of key foundational cognitive skills, math, numeracy, literacy, language.
Well, thank you. So we'll keep the questions coming into the Q&A box and the chat, keep it going. And I think I want to just underscore, at least with your presentation, Anna, is that right, when you are hungry, right? Somebody like me who grew up in poverty, when you are hungry, thinking about work and learning is not front center, right? And then if you're a stress, under high levels of stress, both on the teacher side, but also the family side, there's only so much you can do, especially in the midst of compounded stressors. So I think we have more to talk about and what are things that can be done by professionals and practitioners and policymakers. So thank you for teeing that up. So next, I want to bring forth one of the heroic people that Dr. Johnson talked about, and that'd be Superintendent Gist. Superintendent Gist, we're so happy to have you join us, especially because, Chloe, you are in the school building, but just that you're giving us some time when we know that you're literally trying to figure out how do you ensure that children are experiencing the best learning possible, both whether hybrid, in person, or virtual. So we just thank you for being here. We want to know, we know this is such a challenging time for everybody. And I think as Anna has already articulated for the teachers and for families and children, we salute you and for you and all the other educators for the amazing work you're doing to keep our children and families grounded in such unprecedented times. So I wonder if you can kind of help and reflect on the findings shared by Dr. Johnson. We know that Tulsa Public School has been a partner in this study for several years. And what do these findings mean for you and what you're doing and how you're responding in ways that are both new or different or the same? Just wanting to hear what are you guys doing on the ground?
Thank you so much. And first, I want to just say thank you to the Campaign for Grade Level Reading for hosting this conversation. I've benefited and been a part of the work of the campaign for years, and I'm so grateful for that. We're also so grateful to have Georgetown University and our colleagues at the University of Oklahoma as well, who are part of the SEED study and support that work. So thank you to Dr. Johnson and all of her colleagues for everything that they do for Tulsa. It's sobering to say the least, deeply concerning when you see data that reflects the daily experience that we have with our families and what we see happening anecdotally. The data that Georgetown has that Dr. Johnson shared is also consistent with the data that we've collected internally, data that we've collected through surveys and other work that we've done with our families, our teachers as well. And so we know that the whole situation that we're dealing with through the pandemic is having a massive impact on our students, on their families, and on our team members as well. And that includes our teachers, but it includes also our support employees. And as you were saying, that we can't focus on academics and combat this learning loss without understanding the whole child and considering all of the challenges that our families and our team are facing. And so do you want me to go on? I can keep talking about some of the work that we've done when we launched into this.
I think that'd be wonderful to hear. Yes, absolutely.
Absolutely. So, everything that happened in the spring was just emergency reaction. Shortly after that, we got together and we said, okay, we need to make a plan. So, our focus, we said we were going to focus on equity and transformation as underlying, but we had 5 priorities. And our priorities were, of course, number 1, safety, number 2, wellness. And then we had a focus on supporting our educators as our third, focus on grade level learning, and then partnership with our parents. And all 5 were equally important. Obviously, safety being the number 1 thing, though, in so many ways. But we also knew that we couldn't do it alone. And so as a school district, we're so fortunate in Tulsa to have so many amazing community partners. So we really reached out to our nonprofit organizations, our faith-based organizations, and all of us together have tackled these different critical issues. So I want to just, safety we'll leave alone. I think everyone across the country is sort of dealing with that, but I want to focus on just on wellness for just a moment, because I think it's one of the things that really pops in the data that Dr. Johnson was sharing with us. Throughout the pandemic, our students, their families, our teachers, their families, we've seen what this chronic stress and even chronic trauma has meant. And I would also point out that the data that we were looking at is from 6 months ago. And so imagine the continued effects of the economic challenges, the continued effects of the social isolation, the continued effects of the stress of living through this moment in time. So we launched in and said, okay, in addition to the Chromebooks, and we distributed, more than 30,000 Chromebooks and the food and everything, we knew that wellness was going to be so important. So we launched wellness teams in each of our schools. And these are site-based staff who focus on supporting our students. And they support them on whatever the need might be. It might be a technological need. It might be a need that their family has. We need to connect them to a community-based organization. It might be social services. It might be support for food-based. So we were providing that as well. And we were logging. We've had over 9,000 entries into our tracker, in which we're tracking how are we connecting the need that's been expressed with the resources that we're providing. And our teams are also calling and checking on students who aren't engaging in distance learning, who weren't showing up to be a part of what was happening, to find out what was going on, to see what kind of problems that we could share, what kind of support we could give and what kind of problems we could solve for them. I also want to say that we launched a wellness support line for our families to express concerns or to ask questions. We have team members of ours from the district staffing those calls. And we also offered live trainings for families to help them with the technology and how to navigate all of this and what it was all going to mean. And then I want to talk about our team. Dr. Johnson was sharing that we provided meal supports for our team members. And, everyone was, not everyone, but many folks in both our families and our team were facing these various challenges and seeing the economic stresses that were impacting them. And so we wanted to make sure that we were providing support for our teams as well. So we had a web page that included employee assistance programs. We had monthly wellness themes. We had grief support. We actually, a member of our team was, her spouse was the first Oklahoman to die from COVID back in the spring. And we've had other deaths of parents and spouses. And so this is a very, very serious in so many ways, and people need support and help. Food insecurity we've talked about. We also have a social emotional newsletter that is targeted at adult wellness and things that we want to make sure our team members are doing to support themselves. And so we have these Wellness Wednesday newsletters and a CARES program that people can, where we can reach out to members of our team or their families who, if they've had a direct impact and they need support. And then, like I said, I just want to touch on real quickly back to technology for a minute. So I mentioned the Chromebooks, but I think what's so important about that is that the technology, both the device itself, which we had covered, the internet access, which we worked so hard to get hotspots and internet access. Our city has navigators who will go out and literally help a family walk through getting access to the internet and so forth. But it's actually so much more than that too. It's about knowing how to use the device. It's about having quality content. It's about our team members, our teachers, and others having a brand new skill set and a whole new set of practices. And so there's so much that goes into that is more than just the devices themselves or the technology themselves. Let me stop there and just see if there are other.
I feel like you gave us such a good, like almost like a tapestry, a blueprint of what could we do to support families. And now I want to kind of just ask you sort of this brief question before I turn to Dr. Decker, which is, there's clearly lessons that you as a school leader and educator, right? You know, not just in Tulsa, but obviously in Rhode Island and DC, that so you have a national lens in addition to Tulsa. And we're hearing this sort of mantra of, I can't wait to get back to normal, right? Whatever normal is. For some families, being poor, they don't want, right? So are there lessons that you are picking up from this experience that we're still, many families and children are still under, that you want to sort of take back to build a much better educational system that supports children and families on a major level rather than what it was before? So are there lessons you want to share with us about what you are learning?
Oh, definitely. And I hear that a lot too. I mean, we all want to have our lives back, right? We want to be able to hug on and be close to our colleagues and our friends and our family. And and we want to be in school in person every day in the way that we had where we were able to interact. So there's so many things that we want to have to go back to. But it's so important for us to think about taking all the best of what we were doing, but moving forward. And I'm confident that as difficult as all of this has been, that we can and we will and we must come out of this with new lessons and new things that we have really just learned and experienced, and will therefore be better at serving our children and their families. For us, there are a lot of things. I would say, for one, just our parents. Parents this has been such an incredible stress and challenge for them. And I hate that so much. And we've just tried to support them in so many ways. At the same time, I would say that we are going to have new relationships with them, new ways of communicating with them that are better than we had before, a better connectivity with our families. So I think there's a lot to say there. The getting the internet access, getting the devices, moving, to having a one-to-one program in our district will allow us to have more personalized learning, to expand competency-based learning and things that we've had happening in the district, but not at scale. I would also say that, the emphasis that we've had as a district on social and emotional learning, this experience just makes it so evident why that's important, and has spurred us to put even more structures and supports into place. And things like our wellness teams and our hotlines and our newsletters and the ways in which we're caring for people as their whole selves, I think will absolutely continue. Lastly, we're talking about our younger students right now, but I think from a high school perspective, I don't think high school will ever be the same. Our students are going to want and they should have more flexibility, greater access to courses because of the way that that technology can bring things to life in ways that are more baked into the system than they were before all of this happened.
Well, thank you. And obviously stay on the line. And I'm going to bring, your colleague, Dr. Cindy Decker, on. Thank you for those really important remarks about the lessons learned. So Dr. Decker, welcome to the conversation. Educare, has been a key partner in the SEED study since 2001, clearly before your time, while you were probably still at Tulsa. But can you, obviously from your vantage point, being sort of an educator and a leader in Tulsa for many, many years, can you tell us more about the history of working together and your thoughts about the SEED study, the design, and its potential impact and implications for the work you do and lead?
Thank you, Dr. Aruga. It is so wonderful to be here today with you, and thank you to the Campaign for Grade Level Reading and Dr. Johnson for sure, all of her Georgetown team, and also I credit the University of Oklahoma, who's part of this study too. Yeah, I have had the pleasure of being working with Georgetown for a number of years. So I wanted people to know that this amazing SEED study is actually part of a larger portfolio of work that Georgetown has been doing along with Tulsa Public Schools. So we have a great research practice partnership focused on early childhood. The original studies looked at the impact of the 4-year-old Tulsa Public Pre-K year. They expanded to then include Head Start's 4-year-old year. And I was super excited. I was on the ground as this SEED study was being developed. We in Tulsa, the early learning leaders, kind of advocated, can you please start at age 3? We know a lot about starting at age 4, but we really think you might be missing something. And we'd often hypothesized in the other studies about how the findings might be driven by some lack of, or how some of our thinking might be limited because we weren't sure what was going on in the 3-year-old year. So I love that they started at that age. They brought in Head Start, they brought in Educare, and they brought in community-based childcare, which is a huge piece of the 3-year-old learning. And of course, then later they added to the study and added kids who hadn't been in any of those programs. I want to also add that this study, it's amazingly helpful and insightful right now, but I think as they follow these kids through 4th grade, and then they go into classrooms, they're going to go into the classrooms and measure various features that go on in the classroom, and that it was designed this way to figure out what classroom features help minimize pre-K impact loss. So probably many on the call have heard about the fade out of the impact of pre-K. And so the study was designed to help us to provide better insight back to us early learning leaders and to Tulsa public early learning leaders of what we can do in early childhood to minimize that pre-K impact loss. But I'm now wondering whether those same classroom features might help minimize the learning loss due to COVID.
Thank you. You know, the funny, interesting thing that you said, and I was like, yes, you're a researcher, because you know, most people think researchers, we just have these brilliant minds. But right, the fact is that, Anna, listen to what the community leaders, like you said, like, why don't you start in 3rd grade or when the children are 3? Thank you, right? That's a whole new research. So I really appreciate your commentary in terms of how that research program partnership can really work to really benefit children and families. So I want to hear a little bit more now of your reflections of what Dr. Johnson was talking about, right? So what does this mean in terms of what she was finding in terms of the impact of COVID on both children, on families, and the workforce? And what does that mean for you on sort of the Educare Tulsa side? Is there anything that you can lean in from that, or glean from that, I should say?
Right, so at Tulsa Educare, we serve children as young as 6 weeks of age to age 5. And so focusing on those years specifically, the parental depression increases that were noted are extremely worrisome. I want us all to consider, I'm sure many on the call have had young children at some point in their own lives. If you hear your baby crying from the other room, if you're not depressed and not tired, it's still sometimes hard to get up, go get the baby, soothe the baby, calm the baby, meet the baby's needs, and go back to whatever task you had else to do. But if you are depressed, you might neglect the baby. You might go see the baby but not be very soothing. You might choose to not to tend to the baby's needs. And while in some ways these seem like really small things in life, this is how the baby learns that the world is safe. We talked a lot about mental health with Dr. Gist's approach and wellness of staff. Well, babies have to learn that the world is safe, because that's the only time that then we can really start learning and asking bigger questions. I know, Dr. Aruka, you mentioned about growing up without food, and the same thing would come true with that. So I'm extremely worried about that. And of course, I want to mention the term adverse childhood experiences, ACEs, as they are shortened to be called. That's neglect, abuse, and severe household dysfunction. We are very worried about what's going on. Many children, a lot of the ACEs were found in the past by children coming out of their houses and coming to Educare and community-based childcare, so we can identify and then get resources to the families to support. And a lot of that's not happening right now. So we're nervous about that.
So, so obviously I remember I asked a question from the Q&A about sort of, what should we expect? But now there's also the conversation around, early education, is in great danger of a lot of losses, right? Obviously, due to COVID-19. And it's obviously these conversations around transformation, or transforming the workforce, transforming the system, especially with COVID-19. What are you seeing? Like, what do you see as sort of what we need to do in early education education, especially in light of that we have a lot of children, young children who are at home, potentially experiencing lower quality care in their programs, et cetera. Like, what do you see as the potential opportunity to create a much stronger, equitable, higher quality early child experience? What could you tell us about what we could do?
Yeah, there's a lot to say there. I just want to begin with saying within early childhood programs, we've also been extremely creative and innovative. We were all brought to this profession not due to money, I hope everybody knows, but to make a difference. And so when the people we serve are hurting, we're hurting, and we're doing everything in our power to help them. I do want to mention that there's been amazing support from the Office of Head Start to Head Start providers through this experience. They've given us flexibility, so because it feels they are trusting us. They are trusting us to do what we need to do, what is the best for our community. There's been amazing support through the Child Care and Development Fund for childcare that goes through then to our state. Our state has, for the first time, changed how they make payments to providers. It's always been the past been based on attendance. Well, attendance in COVID is not good. If you're not supposed to come to school if you've been around somebody who has COVID. So they're now paying based on enrollment, and that's helped tremendously. There's also a federal bill that's in front of Congress, $50 billion to help the child care industry. It did pass the House, but still working to get it fully passed. There's been amazing partnership with Tulsa Public Schools for food resources, mental health supports, philanthropy to get cash directly to our families. And I'll also say amazing partnership between Head Start, Tulsa Educare, and childcare in town. So we are lucky enough not to use our Head Start money, so using philanthropy money, don't get worried about that. But we are helping our childcare partners because we in Tulsa are acting collectively. We're not competitive against one another. We're really coming together in new ways to help our community get through this. We're providing childcare providers sometimes direct cash, COVID cleaning supplies that they've had a harder time getting to, lots of books for the kids they're serving, and providing like a virtual reading from time to time. But you also asked about rebuilding. So before I go into the rebuilding, or whether sometimes it's building, because in early childhood, we like to say we don't even really have a system right now. We're very fragmented. There's lots of different funding sources. It's extremely confusing. And so we're wanting to build an effective system as we get out of this. But in the meantime, there's so much loss going on within the childcare industry. Childcare operates on razor-thin margins, and those razor-thin margins have gone away. We know childcare providers are closing their doors, and that's very scary. So as we build, we want to do it though inclusively. We want to do it in the best way that makes sense for the families that we serve. So we need to do a lot of listening of how to make quality childcare programs exist for those who want it and would benefit from it, that's close to their house. So right now there's no collective body really placing these providers in the optimal places for the returns. Instead, it's just, oh, Cindy, decided to open up my home and operate this quality childcare. And so we really aren't reaching oftentimes those who most need us. I'll stop there and see what questions you have from there.
Well, thank you. I'm actually you brought in your partners, including your philanthropic partners. I want to sort of now open it up for Emma Kane to join us also in this conversation and get the point of view from a philanthropic point of view, right? From the sides of, an important segment of trying to both strengthen and build early care education in a more unified way. So Emma, thank you for joining the conversation and staying plugged in there. So Emma, you bring such an important lens to the work and this space here. And that's really philanthropy. You're such an important partner, especially as Dr. Deck was talking about, how do you bring in other partners where you have different funding streams that might not allow you to, and philanthropy is such an important, innovative partner in that. So from your perch and where you situate, what are your reflections on the Tulsa Seed findings, and what does that mean for children and the life course and their learning and impact of COVID-19? What's your reflection as a funder?
Thank you for that introduction. And I want to say thank you so much for letting me be a part of this conversation today. One of my greatest pleasures is taking research and best practices and using that to guide our work. And then conversely, participating in informing research by what's happening on the ground. And so I'm always so grateful that this is also the outlook of the campaign. And so being a part of this conversation is so very, very exciting to me. I want to briefly give a little background on where I'm situated and the context in which I live. So welcome to my office. United Way of Wapello County is still working from home due to COVID-19. And I want to talk a little bit about who we are as Wapello County. So we are in southeastern Iowa. We have a population of about 35,000. And our poverty percentage is 14.2. So we have 14.2% of our community living in poverty. And we know that that poverty rate is kind of arbitrary. We know that folks who are just over that are still struggling. And we see that in the data. And just for comparison, the Iowa rate for poverty is 11.2. So we're higher than the state average. We have two school districts in Wapello County. We have the Ottumwa Community School District, which has about 4,800 students. And then we have the Cardinal School District, which is about 800 students. So that's like the total student body from K to 12 that we're looking at. We are a community of high ACEs scores that's been documented, and we have significant proficiency gaps pre-COVID and now during COVID. We're also rural by most metropolitan standards, but we're fairly large by Iowa standards. So that's very interesting to be a part of. As Dr. Decker was saying, talking about childcare deserts, we are experiencing that in Wapello County as well, of quality early childhood education. We are blessed with an amazing early childhood education center run by the school district that opened 2 years ago, and they thought was going to have about half capacity, and then all of a sudden there was a huge wait list, which just kind of went to show the need that we have in our community. And then again, providing context for my employer, United Way of Wapello County. We fight for the health, education, and financial stability of every person in our community. And we mean every person when we say that. So in terms of philanthropy, what we do, our role in the community, we are one of the major funders in our community for programs that specifically meet the needs of our community, and especially meet the needs of minoritized and under-resourced community members and populations. And so we grant about $250,000 every year to various community partners who are doing the work. And then we also have an amazing force of volunteers who are also helping to get the work done. So that's the context of where I am situated in the philanthropy realm, in the nonprofit realm, and that's kind of the broad strokes of what we do. The results that the study showed are mirrored in Wapello County and in Iowa. Because of COVID, food insecurity has doubled here. It's tripled for households with children. We know that to be true. And I also think it's important that the study tells me that it's not just the school district's responsibility to meet these gaps. School districts are tapped at capacity. They are doing amazing work, and more work needs to be done. And they can't do it, and it's not their responsibility to do it. Educational interventions are not enough, and that's what's this study is proving as well. We know that if kids are hungry, they're not going to learn. So how are we going to provide supports as a community to get that work done? And I think that's the role that community partners and philanthropy can play in this.
Thank you for that. And then, I mean, and Emma, you guys won sort of an amazing, you got a national attention for doing something pretty amazing in your response to the pandemic and meeting all the needs of your children and families. Can you please share with us what that was, and so we can all celebrate you and your team?
I love nothing more than to brag about my community, so I will I will definitely do that. So our students in our county did not come back after spring break due to COVID, and it became immediately clear that kids are still hungry. If they're not getting breakfast and lunch at school and they don't have the food at home, then they're not getting food that day. And so, and again, I'm not taking credit for this work at all, community effort completely. The why actually is the one that this program was built out of. So it was called the Emergency Youth Food Program. And they, in the beginning, provided breakfast, lunch, and dinner every day. Pickup was Monday through Friday. And then on Friday, you would get food over for the weekend as well. And so there were locations all around town to pick up that food. There were, it was available for 10 minutes, so we could get people in and out and try and not have them touch each other and all of that. And those locations were chosen strategically. They were chosen, after a lot of discussion about where is the most need, where is it most likely that kids and families would not be able to travel somewhere else to get the food. So we saw locations in trailer parks, apartment complexes, and at some of our lower income schools. And so those were chosen really strategically. And then my favorite part of the program, and the part that we got some attention for, were what was called the Y Street Journal. And I have to give Kayla Powell, who worked at the Y at the time, all of the credit for this. This was her idea. But every day in the food bag, the kids would get a different Y Street Journal. So it was a new one every single day. So that takes a lot of work. And the Y Street Journal would include a daily check-in on emotions, and it would have emojis for younger students and students with special needs to be able to kind of express themselves a little bit better. If the word sad didn't really communicate what that emotion felt like, the emoji would do it. It had a scale, rate your day 1 to 5. Why did you rate it that way, and what could you do to make it better? And then it also had fun activities to get the kids something to do, how to make a paper airplane and things like that. And then it also had, an educational component as well. So it would have a vocab word, and it could be something really silly, or it could be quarantine. And so it's giving kids the language in a way that they understand to talk about what their reality is, and also for parents to have that language if they don't understand. And the amazing part for me was that the students and the kids, because this was age 3 to 18, could return their journal the next day and they would get a prize. And it was something silly, like those party favors that we throw away immediately when we receive them, but are really exciting for kids. And the goal of that, honestly, was to make sure we had eyes on kids, to make sure that they were doing okay, and to see if we needed to make any interventions or any referrals in terms of abuse and neglect. And it was really successful, especially in the beginning. Kids were excited. They didn't know that we were, checking up on them. They just got a prize. And because this was housed out of the Y, it got attention, national attention from Y of the USA internally. And they used our process, our structure, and the journals to help develop resources for other Ys in the country. And because I'm not an employee of the Y, I don't know what that turned into, but my colleague Kayla Powell was asked to help be a part of that creation process. And so we fed about 1,000 kids every day. We're a population of 35,000. That's a significant number of our community. And I could talk more and more about the program. We had, really heartbreaking moments and really exciting moments from those journals, but it was a simple intervention, not an easy one in terms of creating that content every day, but it was a simple intervention that I do think had a significant impact on the work that was happening during that time. And the program ran until school started back up. And now our district, for those students who are distance learning, because we've got a hybrid system, also have access to food. They can do a weekly pickup. And so then they also have food for the week. So that's a brief overview of the program. I could go on and on, but I will stop for now.
No, but thank you. I mean, if I had my emotion emojis, I would have given you, like, I could see exactly why you got national attention, right? To think that children, families to eat breakfast, lunch, and dinner, and on the weekend, and obviously checking in on children, in different ways that's fun and not, too intrusive. So kudos to you, to the community, to the good thinkers. So I want to welcome back all of the, Dr. Johnson, Dr. Decker, Superintendent Gist, and you remain on there as well, Emma, to really just, engage in some Q&A, both with those who are there in Zoom land, Facebook land, to engage in a couple of, some questions. I know we have some Q&As, but since I'm the moderator, I get to have my first set of questions. So Dr. Johnson, you can also join us as well. So I want to sort of push us on a little bit. So I do a lot of work around racial equity, think about children of color, minoritized children. And, we know that children and families of color particularly have been hit hard, both from the health side of COVID, but also have always had great challenges pre-COVID. And so obviously during COVID has been even more catastrophic. So what are your thoughts, right, in terms of both, and from your point of view, Dr. Johnson, anything in particular that you would do differently or capture, especially with that in mind? And then obviously similar questions to both Superintendent Gist and to Dr. Decker and to Emma about, are there certain things about equity, especially as we also go through two pandemics, the coronavirus and racial reckoning? Are there things you would do differently or could do? Oh.
I mean, I would defer to the practitioners with boots on the ground to that one, because, all I can say is in Tulsa is very, very diverse. So there is, we have an opportunity to look at things like our marginalized communities. There's a large Native population. There is we have a number of Native Spanish speakers. So we've got a large dual language learning community of typically Mexican origin. But that identify as Latinx. We have a somewhat smaller proportion of Black students in our sample. So it is a very race and ethnically diverse sample. And I will say that our results of, with respect to like challenges like food insecurity, mental health, job loss, are hitting those minoritized and marginalized communities especially hard, just like they are everywhere. So insofar as the research can speak to patterns that replicate in Tulsa as they do elsewhere, I can say 100% yes, this is a community that is experiencing the same disproportionate hits to communities that have already withstood, historic challenges and barriers. So in terms of what to do to address that, I'll defer to the practitioners who are partnering on the ground with these families.
Thank you. Superintendent Gist, Dr. Decker.
Absolutely. So yes, the point that you made, Dr. Iruka, is that we have multiple things going on in our community right now. So we obviously have a public health crisis with COVID-19, but we also have this, this racial reckoning, awakening that has the promise of progress, but is also very intense at the same time. Is I've heard it called COVID-16-19. It's a whole nother body of work that communities and school districts have long needed to be addressing, but certainly is right before us at this moment. And then the mental health crisis, the education recovery crisis, the economic crisis, all of these things, none of them are new, but all of them are exacerbated. All of them are enhanced and more intense, more difficult, and more in front of us. But within all of that is an opportunity. And schools, what we know is the schools cannot do this alone. That has always been true, but it's never been more true than it is now. And so all of those partners that we've talked about, our early childhood partners, including our friends at Educare, higher education, our nonprofit organizations, our faith-based organizations, and our families themselves, we really need to create what I think I would call a city of learning, so that it's not this idea that learning happens in school and then we're at home, or then we're at childcare, or then we're at church, but rather all of us together are focused on the experiences that our children are having and the ways in which they're learning in those experiences, and making sure that they're cohesive across those by all of us partnering together. I would also say that focusing on the whole child, and yes, academically, of course, yes, socially and emotionally, of course, but also the whole educational experience and what comes into play there, including making sure that our schools are places where children and team members can show up as their whole self, whoever they are, whatever identities they connect to, and to know that they are loved, they are celebrated, and to have that experience in the school setting. And then lastly, I'll just say that the inequities, and I would actually say injustices, that are baked in right now to our society, which includes our school settings, we have to address by making sure that we have equitable supports for students and families that were already needed, but are really being exacerbated by the inequitable challenges that the pandemic is presenting.
Thank you for that, Superintendent Gist. Dr. Decker, Emma, anything you want to sort of add in terms of other new thinking that's happening, both due to COVID-19, but also I think really to Superintendent Gist's point about sort of the racial reckoning and injustices that has been with us for centuries?
Yeah, so I'd say in Tulsa, we pre-pandemic were already moving and talking about equity from the city government, even leading that work of talking about quantifiable measures and comparing across race. And so we entered the pandemic with already these discussions happening, but it does feel that the pandemic and the light that's been brought to how that hits different families differently has maybe made some people now the light bulbs turned on more. And so we do have an opportunity to think harder. I mean, one simple example that I see from my perspective is that we have a Black majority school within Tulsa Educare, and then we have ones that aren't Black majority. And we see different patterns of the families in those schools, and it is as you would think. The Black families might be less likely to call us back if we call them, or be ready to bring their child back to our school. And so we need to not let that be the case. We need to find staff who reach out again, staff that can make those connections. It's about connections. Dr. Gist said connection, 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 I think 4 times in a row in our original talk, and I liked that a lot. So we can't be based on number, often funders have been focused on numbers served, and that's not going to get us to getting racial equity. We have to care about quality and equity instead of how many you've reached.
Thank you. Emma, anything you want to jump in and say, especially from the work you've done in a philanthropic lens?
Yes. Wapello County and Ottumwa is a very interesting place to live. We are incredibly blessed with a very diverse population. And we also live in a rural southeastern part of the state of Iowa, which historically has been very white, very agriculturally based, and that 14% poverty rate isn't new. You know, that's been an issue this entire time. And so while our immigrant population increases, and it's increasing exponentially, there's a very interesting clash and tension that comes with that very quick influx of new community members. And talking about these things is hard, right? We want to ensure that everyone, and we mean everyone, at United Way of Wapello County is getting the resources that they need. And that means taking a step back and looking at the way that we've done things. And why do we do the things the way that we have? What decisions inform that? What people informed that policy or that procedure? And taking a look at our current landscape and really assessing what the needs are in our community. And that's hard when all of your connections are with the people who look like you, who talk like you, and who are interested in the same things you are interested in, that have been informing your policies and your procedures. So it means expanding your bubble to new folks, and that's scary, but it's important. And so as United Way of Wapello County, we are in the process of really making sure that everything we do is equitable and thoughtful and intentional. And so when we talk about addressing these things, we have to be intentional about using disaggregated data and making sure that we're not just looking at proficiency rates in general, we're diving into where the biggest gaps are. And so from a philanthropy lens, it's about including new community partners. It's about including new communities, for example, building relationships with the Latinx groups that are in our community. We're working on doing that because we need to meet the needs of that community. We need to make sure that one of the phrases that I say a lot is doing the most good with the least harm. And we need to make sure that we're doing that thoughtfully and intentionally. And I think philanthropy, because we've got the dollars, right, to be perfectly blunt, can be a great driver in that, you know. If we require, you know, an equity review before giving you a grant, that gives us an idea of the work that you're doing, and it will inform the work that you're doing. And so for me, this is such an important topic, and I try to do all of my work through an equity lens. That's really what drives me. And I think good philanthropy needs to do that as well. And I think here in Wapello County, we're in the process of doing that, and it's really exciting.
Thank you so much for sharing those insights. I think there's a poll. Did a poll just pop up for you to complete? Again, it's to help the quality of, as my son comes in and interrupts me as usual. Give me a second. And I wanted to actually ask you guys, and maybe particularly there's a question that came in that she thought was really important to ask from Sandra Woodford. She's wondering, or it's a he or she's wondering, this person's wondering if there's a documented positive association with school districts that focus on equity and social emotional learning as compared to districts that do not. I mean, I have my response to that, but I wanted to see if any one of you guys want to respond to that, right? Is there documented evidence?
Well,
and so I go ahead. Yes.
I think that I would leave it to the researchers because I don't know of any studies off the top of my head, but I would say that one of the things that is so important is that we go beyond awareness, we go beyond identification of inequities in our systems by disaggregating data. We go beyond making ourselves and members of our team and our community aware of the needs, and into action and change that's going to result in more equitable outcomes. So we know there are inequities in the system. There are injustices in the system. There's historical reasons that we have such differences in our communities. And that's in every community. So many reasons. Historically, we know that, and we can look back and see the things that have happened. Here in Tulsa, we're coming up on the centennial of the Tulsa Race Massacre. That has deep roots and has affected both the emotional lives, but also the economic lives and the health of our communities. And so being aware of those things is hugely important, but it's also important to then make sure that the behaviors are changing, the actions are changing, and that we're providing different equitable responses and supports for students and families to make sure that we're bringing about more equitable end results for our children.
Thank you. Any other responses people want to say to that? I mean, I'll just say this, since I'm the moderator, and I feel like this is one of my areas. I'll say to that question, I appreciate the question, but it's almost like, why do you need evidence, especially when racism literally is the foundation of the country? So it's almost hard to even say, what would it look like? It would look like, I think, to exactly what Superintendent Giss said, which is you wouldn't have these disparate outcomes, you wouldn't have these inequities, you wouldn't have sort of these losses of human capital. And so to me, the evidence will come once we actually become an anti-racist country, right? Because even if you address it on the school level, the racism is such the way we breathe that if it can be invisible in the school, but it shows up in the healthcare, it shows up in your neighborhood grocery store, it shows up in the police force. So it's literally the air we breathe. So getting rid of it, quote unquote, rid of it out of one place doesn't actually take it away from your life, especially if you're a Black or minoritized person. So I appreciate the question. I think if you separate out the racial equity part from SEL, there is lots of evidence about the effectiveness of social emotional learning for children's outcomes over the life course. Is one of the things that we see in early intervention that really shows that is really what creates the impact of early intervention on lifetime health outcomes, is the social emotional learning. But I think the question about racism is really hard because it's literally the air we breathe. And so I think this is the work we have to do. And then once we do it, we probably will see the effects of it on every single level, from education to health to opportunity to families who are not depressed, and education workforce that's not depressed and underemployed and underpaid. So that'd be my 5-second comment on that. Any other questions any other questions, people please put it in the Q&A. I did want to ask you guys, there was a question, I thought I saw a question from Shannon Christensen, but maybe somebody has already answered that. So somebody did ask about, I think maybe it was you, Dr. Decker, that talked about ACEs. And so somebody did want you to provide the information about ACEs. So there's a lot of questions about that. Another question, Emma, to you is, do you have any links regarding your success with the food program? And the emotional check-in, they'll like to kind of share with their own association. Hopefully it's in the chat box somewhere. The link has been provided about your program that you guys have done over in Iowa. So anything you could share with that? Somebody wanted to know about that.
Yes, I can absolutely share those resources. I'm trying to think of the best way to do that. I will, you can reach out to me through Twitter or through email and I can get them to you directly. I'll also work with my state lead at the campaign to get them into CLIP so that folks can access them that way as well for folks who are part of the campaign.
Great, thank you so much. So I did have a question. So Dr. Johnson, to kind of, obviously you'll continue with the study long term. I mean, I guess my question to you is, obviously, just based on our conversation, are there any other things that you're collecting that we should be looking forward to, whether around teachers, children, families, and even, pushing further with sort of this idea of, racism and how it really does seep into everything, including research. Are there any things that you're exploring to address any issues around racism, or ensuring that we're capturing much more information about the wealth that families of color in particular bring? Just curious about your research moving forward.
Yeah, I mean, so the study as it was designed is really focused on understanding the impact of pre-K, which happened in 2017, 2018 for these kids, on their longer term outcomes. And as part of that, we have what we call a 360-degree kind of data collection strategy, where we are collecting data on teachers and classroom observations, and then direct assessments of children. Like I mentioned, we have a big component where we're collecting health data. And so that, I think, is one of the big places where we're going to be able to offer some insight into the effects of kind of systemic institutionalized racism and its impact on children's health, getting under the skin of these kids' well-being. So access to healthcare resources, I'm expecting we're going to see differential access by race, ethnic background, and then health outcomes. We know there's a really big impact on children's physical and mental health. And so we're going to be incorporating some of those questions into research that we've already planned. Also, we have an opportunity to look at, I don't know how to kind of provide some insight into the bias that measurement introduces, racial bias in psychometric measurement. So because we measure everything using many different methods, so we have direct kind of paper and pencil tests, we have observations by trained assessors, we have observations by teachers who know the kids, we have parent reports of things. We're able to look and get a little bit of a sense of how much do these things correlate in a kid who is this profile? How did these things correlate in a kid who has another profile? And if we see, that the what we might consider the most scientifically unbiased assessments of something like behavior suggests that kid A and kid B are very similar on behavior, even though they have different race, ethnic identities. And then the teacher observation says that one kid is behaving badly and one kid is not. That's really valuable information, right? So we're going to try to get some purchase on that kind of a question, kind of race-based bias in how we measure children's development and behavior.
Well, with that, I want to say thank you to each and every one of you, to Dr. Johnson for her research, for Superintendent Gist for really being here with us in the midst of a global pandemic as you take over school districts and do better. And obviously for Dr. Decker to be here leading sort of the early childhood space. And obviously for our colleague Emma Kane for being here with us, sharing her knowledge around philanthropy and innovation. So thank you, every one of you guys. And I'm happy to have moderated and enjoyed and got so much. And now I pass it back to Yoli. Yoli, thank you so much for inviting me to be here.
Great. Well, thank you, Dr. Iruka, for such a lively and thoughtful and important conversation, not just about the impacts as we have known them for a long time on poor kids and kids of color, but really shining the light on how much deeper this work is now that so much has been laid bare. And for the communities that are in the network and have their local coalitions around grade level reading, the findings, Dr. Johnson, that you have shared are so important. The communities in the network are paying attention to what's happening to kids and families so that they can pivot, so that they can make the right decisions with their time, their partnerships, their attention, their resources. So we're so grateful that you would share the information, the findings, the research, obviously hearing from Dr. Gist and Dr. Decker on the impacts for kids in the early years and the early grades and how you are responding helps really shine the light on some bright spots and the work that we all now need to do. Emma, bringing your story and the amazing, innovative, creative, thoughtful work in your county in Iowa also gives us some inspiration that there's lots of great ideas, lots of ways for us to support our families. So to all of you, thank you for being part of this conversation. We look forward to re-engaging you again in the future as we continue GLR Learning Tuesdays. So as I wrap up, let me just quickly highlight the upcoming webinars that we hope you will join us. We've got 2 more until the end of the year, and then we'll take a little bit of a break. And then we'll welcome in some new conversations in 2021. So next week, you'll see we've got 2 conversations at 12:30 on December 15th. We'll have a funder to funder conversation around policy solutions to reducing child poverty. And then at the 3 o'clock hour Eastern, we'll be engaging partners around scaling playful learning. And I think Dr. Gist talked about how learning happens everywhere. This is that conversation, and we're going to go deep on that. And on January 12th, as we welcome in the new year, we'll have with us Randy Weingarten and Becky Pringle, both leaders in teachers unions nationally, and they'll be having conversations around lessons learned. So we'll look forward to that. With that, thank you again to all of you. We look forward to our time together next week. Today, be safe and take good care.